Thank you for watching the video on shoulder pain. And so I wanted to talk about some common reasons why people come into the office of why they're having pain in their shoulder, and just try to explain a little bit of what shoulder surgeons think about in terms of how these things are happening in your body and what's causing pain in your shoulder. So one thing I want to talk about today is the most common reason why I see, or the most common cause of shoulder pain that I see in my practice of seeing shoulders, and that's something going on with your rotator cuff. And most of the time when I see someone that comes in with pain in their shoulder, at the top of my list is either a tear in your rotator cuff or some type of bursitis or impingement in your rotator cuff. And just kind of explaining what the rotator cuff is and what its job is in your shoulder. If you look at an image of a shoulder, or a model of a shoulder here, you have is 4 tendons that encapsulate your shoulder. We think of the shoulder as a golf ball on a tee, so to speak. And there's 4 tendons of your rotator cuff: your subscapularis, supraspinatus, infraspinatus, and teres minor. And those 4 muscles, their job is to stabilize your shoulder, okay? And if they're not doing their job, or if they have a tear so they can't do your job, then you have some instability in your shoulder. And typically this bone here, your humerus, can impinge upon your acromion here. And so it's not so much that the reason why you're having pain is from the impingement, it's more your rotator cuff is dysfunctional, and so you get the impingement. But and then also you can see here too, the biceps tendon that goes inside the shoulder, it takes a right turn as it comes into your shoulder, and it can commonly be diseased or cause pain in your shoulder as well. So that's the most common reason why we see shoulder pain. The way we diagnose it is with physical exam history, and then I use an ultrasound machine to diagnose your tear if you have one, or if you don't have a tear. That's important information to know. A typical treatment is we do an ultrasound guided injection of some anti-inflammatory medicine to calm down the pain you're having, and they get you into an exercise program to strengthen the muscles of your rotator cuff. And by strengthening those muscles, you'll then have more stability to the shoulder and less pain, because that's really what we're trying to get, is more stability to the shoulder. And whether or not you have a tear will kind of direct our treatment. But even if you do have a tear, often you're able to strengthen the muscles of the rotator cuff to compensate for that tear on occasion, and have a functional shoulder that doesn't cause pain.